Okay, let's talk about community impact. I see Chief Joseph Gilbert from Walpond First Nation is here, and he's going to have some comments to say when I'm done. I don't know, after that applause, you might want to run for mayor. I say that with the greatest respect. He's a great guy. Okay, let's talk about the impact on the community. There was 21,000 visits to the emergency department of Sydenham District Hospital in 2008. 21,000. And in the report, they tried to make the point that, well, you know, only 4% of those were really emergency, life-threatening situations. And I actually had somebody say this back to me, it was only 4%. Well, I said, you know what, 4% of 21,000 is 840. And I said to this person, would you want to be one of those 840? That's 840 life-threatening level emergency cases that were dealt with in 2008 at Sydenham District Hospital. I don't know about you, but I would not want to be one of those 840. You know, we always talk about, and you hear all the governments talk about the rural way of life, how they want to protect the rural way of life, how the rural way of life is so important. Well, you know what? Closing down a rural emergency room in a rural hospital flies in the face of that, and if they truly believe that they want to protect the rural way of life, then they should all be standing up at the province defending our hospital. Let's talk about economic growth. We don't have an emergency room in here. Why would a new business, why would a new family, why would a senior citizen choose to locate here? That has got to be a huge negative effect on what we're trying to do in this community. We've had our share of hard knocks. We need to have something good happen here. We need to have some new economic growth. You know what? They take away the emergency room and they take away the hospital. You might as well forget about all those other plans for economic development because you're just taking away one of the greatest tools to attract people. Healthcare tax. You're going to take away an emergency room in a hospital? Give us the tax back. Chatham-Kent Health Alliance raised $1.9 million last year. Maybe they should use some of that to keep Sydenham emergency room open. The MRI campaign, very useful piece of information. I went over, helped build that house. I did it over there, did a very small part, but nonetheless helped, and I feel somewhat betrayed because I thought that we're all into healthcare together in this community. We weren't Chatham versus Wallaceburg. Everybody was helping everybody else out. I feel betrayed, and I don't like that. I want to ask Sheldon Parsons to come up for a couple minutes to say a few comments. Then I'm going to talk very briefly about where we go from here. Then Chief Gilbert also has some comments to make. Sheldon?
Shirley said to make it quick. First of all, thanks to Shirley.
Yeah, right into it.
Let me get a little closer then. First of all, thanks to Shirley and her folks for setting this up. I know that the community, and we've kind of hijacked your meeting, but we appreciate the opportunity you gave us. And to Jeff for stepping forward. Jeff, this community always appreciates what you do for us, and again, kudos for your stepping forward to do that. Thanks to all of you for coming and all the people that are going to eventually come in here for a second round of these meetings. You're showing your support, but you're also showing your concern about diminished healthcare services in this community. I want you to let you know what councillors and your municipality is doing about this. 4 months ago, there was an email rumor circulating about planned hospital cuts and a study over a review of our ER department. I met with Brian Armitage and Bill Pollack, and we formed a group of community leaders to meet with healthcare providers to understand what is going on. We've met 3 times, and we continue to meet to develop that better understanding. What we've learned so far is that the ground is shifting underneath us. Even healthcare providers don't know what other healthcare folks are doing. There is a significant change in funding, And Jeff talked about the LIN being set up to distribute funds. There's fewer funds to be distributed. And if the Health Alliance were here, they would tell you that their costs are going up 8%, 10%, 12%. The LIN is only giving them 2%. I'm not making any excuses for the Alliance, but that's a reality. There's a significant change in who is providing services. You may have heard that this community has been targeted for a community health center. That's going to be around in a couple of years, but it's a different way of providing health care facilities. Family health teams are forming, and there's one in Chatham and Wallaceburg. Nurse practitioner clinics are being set up, and all of this is about delivering services in a different way. There's a significant change in where the service is being provided, and those services are now being provided outside of a hospital, or the bricks and mortar of a hospital. Jeff's talked about the ED study. There is actually a bigger issue, and that is the diminished health care that's being delivered out of the hospital. And only on Friday did we know how massive this was going to be, because 20 beds have been eliminated. 10 have been eliminated completely, 10 are being transferred over to Chatham. So, over the years, well, that's what they announced. That is what they've announced, and that's what we have to fight, because it's as big an issue as the ER department. Now, while health care is not a municipal mandate, municipal council needs to weigh in on the issue and speak out on this community's behalf. So what are they doing? What are we doing? They've created a group to take a look at this study, and certainly Jeff has indicated some of the issues. Lambton County has already done that and found that that study is flawed. We are finding the same thing. We are meeting with the Minister of Health, and a colleague on council knows the Minister personally. He has told me that he will speak to him directly, and when we attend a municipal conference in 2 weeks' time, we have asked for an audience with the Minister of Health to take these concerns forward directly to him. Councillor McGregor has introduced a notice of motion calling for the Chatham-Kent Health Alliance to appear before Council and explain their plans and what they've done with the $5 million that Council gave them a few years ago.
We're at the Capitol Theater!
At council on Monday, I asked the question, was all of that enough? Our counterparts in Lambton County have already met with their MPP. Our council hasn't yet. They are meeting this Saturday in a rare weekend meeting and invited the who's who of decision makers to discuss the report. We as a council haven't done that yet. They have already completed their study of the study and found that it is flawed. On Monday, I presented a petition of 300 folks who signed their concerns about what was happening. That was presented to council. I know there's a petition circulating today. Please sign it, and that will also be presented to council. What we need to do is convince, and I'm only one vote on a council of 18, but we need to convince council that they need to represent this community on this issue.
Here.
Additionally to that, it is my firm belief that we as a community have to come together, form our own task force, and speak out for ourselves. And I would look to whatever's going to come of this meeting, Jeff, that something along those lines should be formed, and I would support that.